Low Vision and Occupational Therapy, presented by
Amanda Costa
and Roxie. What is low vision?
Low vision is the optometric specialty that involves helping those who are legally blind to use their remaining vision using strong magnifiers, telescopes, and daily living aids. Statistics on low vision.
The older visually impaired population is expected to more than double by the year 2030, when the last generation of baby boomers reaches age 65. The older visually impaired population is the third fastest growing population of people needing services in the United States, being outpaced only by arthritis and heart disease. Low vision statistics.
As you could see in the chart from 2010, it shows the prevalence rates among the different races in the United States. Caucasian, African American, Hispanic, and other. You could see that it's very high at the age ranges of 75 to 79. Occupational therapist. Dawn Texas is a licensed therapist, occupational therapist, practicing at Pine Acres Nursing Home in Madison, New Jersey. She first started out at Kessler Rehabilitation Institute in West Orange, New Jersey, specializing in low vision.
Let's hear what she has to say.
College 1990. I originally started working at Kessler Institute in West Orange in spinal cord injury and neurological disorders, amputees. I did driver training for the disabled for about 7 years while I was there. So encountered a lot of clients who had vision problems as well due to strokes, due to diabetes, age-related visual disorders, and then just overall motoric deficits that required adaptive equipment in the car for driving. I also worked with the neuro-optometrists that we had come to our facility once every 2 weeks, and I would do vision screenings on people to see if there were any other interventions beyond therapy that were needed, that needed to be diagnosed, and if there was any kind of vision therapy exercise that needed to be incorporated into the therapy program that they were currently in for their disability of what they were there for. Usually if they needed any kind of therapy, it was done in the occupational therapy classes. And if there was anything that needed to be followed through with in physical therapy, then we would confer with the physical therapist and discuss it with them how they can incorporate it into, their gait or, safety in their environment, walking in the environment.
Okay. So what performance areas do you find most like the reported problems in patients with vision problems?
Performance problems as far as like ADLs?
Yes, ADLs, IADLs, major.
Depending upon the population, you'll see complaints in different areas. Obviously, the younger population have more difficulty with technological type issues, with computer use, phone use, desk skills, whereas more of the older population, more complaints with, again, and they seem to be a little more traditional old school, not as much technology related issues, but just being able to perform like cooking tasks, like not being able to see labels, reading medicine bottles. Lighting is an issue in the environment when they're walking or within their house. If they are still driving, complaints of glare. So usually, recommendations would be to avoid, driving after it gets dark or when dusk starts to hit. So depending upon the population that you're talking about, you're going to see the complaints vary in that area.
Okay. Do you think low vision has a significant impact on the patient's roles and habits and routines?
Absolutely. I've noticed that when the vision starts to fail, you see an increase in their frustration to perform tasks, and also you start to see avoidance and more attendance-related behaviors start to arise. Some people go into denial about having any kind of vision loss, especially when it comes to their vision impacting their ability to be able to drive, because besides, well, every state has their requirements of what vision needs to be able to drive. In New Jersey, it's 20/50, and that's either corrected or uncorrected. So when you start to have issues of macular degeneration, diabetic retinopathy, cataract, that starts to affect their acuity, which then by law they really should be reported by their physician, and if it cannot be corrected, really should not be driving. So you get a lot of denial, a lot of anger, and avoidance to things that they need to do, or procedures they may need to have. So we have to deal with both the psychological and the physical changes that are happening with these clients.
As your role as an OT, what would you try to do with a patient with low vision?
Again, depending upon what the low vision area is, usually I first try and do like an interview with them as part of their assessment as to what their day normally is like. What are the environments that they tend to be in? What are their interests? Because again, when you have behaviors now of avoidance and denial, you don't want to lose the leisure activities. You still want to keep them feeling productive and doing the things that they normally did. So I'll look just initially into the home environment. So when it comes to the lighting in the house, what type of lighting do they have? I would also ask them if they do follow with an eye specialist. If they are seeing an eye specialist, and have they gotten any recent evaluations from the eye specialist? Because again, sometimes there are things that can be corrected and they wouldn't need any kind of adaptations or modifications. So closely work with them as well. So if it's within the home environment, first we're going to look at the lighting. We're going to look at any kind of barriers that might be like rugs on the floor. If they're walking with an assistive device, what kind of device are they using? If they wear glasses, I will test their vision with their glasses to see how their acuity is. And if I identify something that maybe has not been identified, I will notify their doctor and have them follow up as well.
Okay.
What areas does low vision affect in a person's life?
It affects activities of daily living, instruments of activities of daily living, and leisure.
How can an OT help?
Occupational therapists train the patient to use the low vision equipment. This can take several sessions, and the OT helps the patient engage in meaningful activities again from the help of the low vision equipment.
Here's the low vision specialist, Dr. Jane Astorino. Examines patients who can no longer benefit from regular glasses, determines strength of the lenses to apply to the low vision devices. The patient is scheduled to then see an occupational therapist.
Okay, hello, I'm Dr. Jane Astorino, low vision specialist.
Okay, Dr. Astorino, could you tell us what low vision is?
Low vision is the field of study of when a patient can no longer be helped by glasses or contact lenses. There are special devices that a low vision doctor can prescribe for a patient to be able to use their remaining vision.
And how does a patient get referred to you?
Normally a patient is referred from their ophthalmologist or their optometrist, and during their routine eye care or specialty eye care, it's found that routine glasses or contact lenses can no longer help. So the doctor...
Evidence-based practice.
According to the authors of Acquisition and Integration of Low Vision Assistive Devices, Understanding the Decision-Making Process of Older Adults with Low Vision, states that to maximize social participation, employment, self-care, play, and leisure involvement, a greater understanding of the complexities of incorporating low vision devices into the daily routine is needed by occupational therapists. Another article stating low vision, developing services for older adults, explains that vision impairment is considered to be one of the most common disabilities among people of all ages, yet the occurrence of low vision impairment increases with age. Some other statistics to support our findings is that the number of older adults 65 plus years in the USA in 2000 was 35 million, an increase of 11% since 1990. Approximately 1.3 million have a low vision impairment. An elderly person with a visual impairment may have difficulty with reading, writing, activities of daily living, safe mobility, and vocational tasks. To meet the growing need for services of older adults with low vision, occupational therapists and other rehabilitation service providers need to develop a collaborative practice models, referral, resource paths, and intervention strategies. The last article we're going to talk about is Overview of Technology for Low Vision. This article talks about the compensatory strategies included illumination techniques and the use of contrast, magnification, memorization of location, and auditory and tactile feedback. Compensatory strategies may include the use of optical, non-optical, low technology, and high technology devices to improve functional visual performance.
Stand magnifiers. These can be placed on top of a page for a person who wants to read for longer sessions of time. Video magnifiers. These are mini cameras that are almost the size of a cell phone. There are also larger ones. People use these for things like crafts. Handheld magnifiers. These are stronger than store-bought magnifiers and come with a bright light in them to help a person read. Handheld telescopes. These are small telescopes that a person holds up to their face so they can see, per se, a price tag on a shelf. This is a head-borne telescope. This is mounted on top of glasses. This is particularly for viewing television, plays, or sporting events.
You can't walk with these on your head.
Bioptic telescope. These are glasses that have miniature telescopes mounted in the lens. Some states allow you to drive with these. Lighting. Lighting is key for people who are visually impaired. This is an example of a lighting instrument that an occupational therapist can issue. Glare and contrast. These are examples of contrast glasses. Contrast lenses can make the image that a person looking at bolder and more vivid. Conclusion.
There is little known about low vision in the field of occupational therapy. Low vision mostly affects the elderly population. The baby boomer population is aging rapidly, which this area is affecting. An occupational therapist working with the elderly population should learn and understand low vision and how to approach it in the practice.
Thanks.